Okay, so this part of the lecture, I'm going to introduce you to some terminology that is commonly used when you're discussing clients who have diabetes. So, and you might have heard some of this before. Hemoglobin A1C. A1C, that's typically what we refer to it, is A1C. It indicates the average blood glucose levels over the past 2 or 3 months. And this is a commonly used indicator of how well a client is managing their diabetes. It's measured by the percentages of hemoglobin molecules in the red blood cells with glucose attached. And this helps for diagnosis and to monitor how well blood glucose is being managed. Another term you are likely going to hear is fasting plasma glucose. And this measures the amount of glucose found in the clear part of the blood after the the red blood cells have been removed, and this is known as plasma. And this is usually measured after an overnight fast of at least 8 hours. And so this is a nice kind of chart to show you the different types of diabetes. So you can see that on the left. And then the different values, whether it's A1C or fasting plasma glucose. There's also something known as the oral glucose tolerance test. But again, that's not used as much, I would say, as A1C and fasting plasma glucose. So again, you are not maybe you're going to one day go on and do more schooling, but currently you are not a medical professional who's going to diagnose diabetes, right? Or prediabetes. That is going to be up to the medical professional to do that. However, it is important that if we're working with clients who have diabetes, they might commonly refer to their A1C values or even their fasting plasma glucose levels. And so they might refer to it in conversation. They might even set a goal surrounding these things. And so it's really important for us to kind of understand and maybe even have this as a resource so that if you are working with a client who has diabetes, you can kind of come back to this and see, okay, here are their levels, here's where they want to go, and you can kind of have a better conceptual understanding of these different terminologies. So medical management of this is important. There are several classes that someone with diabetes can take that can help them better understand how to manage their diabetes, right? It's important to develop a working understanding of the different types of classes, and insulin must also be taken when the individual can no longer make and release their own. So the second that someone is diagnosed with diabetes, depending on whether or not they're insulin dependent or not, they should go and see a diabetes educator, okay? And that diabetes educator is really going to help them understand what they need to do, not just only with insulin through medical management, right, but also through nutrition. So that's a really important thing to make sure that a client who you are working with who has diabetes is also working with their medical team, particularly a diabetes educator. So there's oral and injected medications. And again, to be clear, I'm not going to expect that you know all of these. This is not medical school. And this really is outside of your scope, right? But I wanted you to have a nice resource so that, again, if your client makes their health history form and they fill it out and they mark that they're diabetic and they include what drugs they're using, you can kind of reference this and have an understanding of what it is. Again, it's all going to help you so that you can really be a large player as in their kind of medical team for diabetes. So some oral medications and exercise considerations. So as someone continues to be more and more physically active, they actually might require less or lower doses of certain medications, including insulin, because of the impact that exercise has on blood glucose, right? So that we know that when people are exercising, they're going to utilize the glucose that's within their bloodstream or within their muscle, okay? And when they do that, that is almost acts as if it like an insulin effect. And so if someone continues to take that same amount of insulin as they did before they started exercising, what potentially could happen is it could lead to hypoglycemia. So it's really important that they monitor that and that they're starting to look at the levels of blood glucose as they start becoming more and more physically active. So all people with type 1 and then many people with type 2 diabetes use insulin to manage their blood glucose levels. And they could inject it, they can pump it, right? They can have an insulin pump, which is always connected to them that kind of self-monitors, or actually can be inhaled. But most will follow this basal bolus regimen. And essentially what that is that it includes an injection or use of some sort of insulin. and at each meal. So basically, at each meal, they're going to get insulin into their body via one of those methods, and that's going to attempt to emulate how a non-diabetic person or non-person with diabetes would basically how their body would deliver insulin. Okay, so let's do a little learning recap here. The first question is, how does A1C and insulin play a role in diabetes management? The second question is, what does fasting plasma glucose refer to? And then lastly, what should our clients consider regarding their insulin intake when becoming more physically active? We'll pause here and I'll see you for the next lecture.